guys, welcome back to Medical Coding with Blue. Today's episode is all about real-world coding versus book coding and preparing for an employer's assessment test for medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got an email about this and I'm going to read the email and then we're going to get into it. So here we go. All right, so the email says, do you have any videos on how to prepare for an employer's comprehension exam versus the CCS? The CCS is the Certified Coding Specialist offered with the American Health Information Management Association. And the answer is yes, I do. However, this person did not look at my page in particular when they did their search. If you are going to YouTube and you go directly to my page on YouTube, youtube.com/medical coding with Blue, BLEU, you will see all of my videos there. And when you go to the homepage, there's a little search box. All you have to do is type in whatever subject that you want to look at. Study tips, CCS, CCA, CCSP, CPC, CIC, anything that you want to know about medical coding, advice for nurses, for students, for going back to school, whatever. You can type it in and a video will pop up. I'm just saying. So I did a search on YouTube and could not find one. Again, they went to the homepage of YouTube, not homepage of Medical Coding with Blue. I had a teacher say that it isn't just about passing the CCS and being a good test taker, and that we would need to take a comprehension exam and pass. I don't understand the difference of studying, since I feel if I studied to understand coding concepts and passed the CCS, wouldn't I be ready for a comprehension test of an employer? In my opinion, all of the energy used for studying the CCS would also prepare me for a comprehension test, wouldn't it? Or is there a different approach for each one? Would love to hear your feedback. Thank you for all you do. See, here's the thing, guys. Book coding and real-world coding are two different things. Now, don't get scared. Yes, the coding concepts are the same on the tests and in real life. Yes. However, the format of a lot of these notes is going to be completely different from what you've seen in the workbooks. The workbooks are all about little short scenarios, and the scenarios have all of the information that you need. They have clear documentation. There is nothing ambiguous, and it's very clear and pointed out what they're looking for you to learn how to start looking up codes and putting together procedures and things like that. So that's what book coding is. When you get into the real world, the format is not going to be that way. And a lot of times, some of these providers, the way that they write documentation really has a lot to do with where they went to school, the exposure that they've had to a really good medical coder, or the exposure that they've had to a really bad medical coder. Because if you have a provider who has only had exposure to terrible medical coders, meaning that the coders were never proactive with the provider, or they just let them the provider wants that code, that's what the coder's going to give them. And that's not the right way, because we do not code based on what the provider wants. We code based on what did they document, because if it's not documented, it didn't happen. So in that instance, you want to make sure that you're actually looking at the documentation, comprehending what you see. And when you have these assessment tests, that's what they're going to give you. They're going to give you these real world examples. A lot of times they will give you redacted notes. Obviously they do not have any PHI. And so they want to make sure that you know how to abstract diagnosis, which means you can look at a document and you can pick out the diagnosis codes that need to be selected, and you can pick out the procedure codes or any HCPCS codes that need to be picked up, or ICD-10 PCS codes if you're coding for the inpatient side. And they want to see what you can do. It's obviously not multiple choice when they give you these real world examples. But sometimes they will give you like multiple choice. And the multiple choice questions are typically like anatomy questions, medical terminology questions. Sometimes they are the guidelines questions. If you are participating in my October guidelines wean challenge, which is reading the coding guidelines 4 times this month, if you can, in October, at least the whole goal is to get through the guidelines. That's going to help you in your search. But here comes the other problem. A lot of times when students get their certification, they say, okay, well, I'm ready to start coding. And it depends on where they got their training. Sometimes coders, even though they pass the certification, the CCS, CCA, CCSP, or the CPC, they end up being out there in the real world, and sometimes they really struggle because they went through a fast-paced medical coding program and they barely passed their test, and they managed to get their way in, somehow, some way, because not all of these comprehension tests or these assessment tests are really complicated. Some are very easy. It really all depends on the employer. Now, when it comes to what's actually on these tests, I get that question all the time. What's on the assessment test for these employers? Guys, I don't know. I don't know, because a lot of these places are going to be different, and they are formulating these tests based on the lead medical coder or the supervisor or the HIM director, and they want to test you based on what does their clinic need. If you are applying for a cardiology clinic, you can expect cardiology questions. If you are applying at a family practice place, you can expect a lot of family practice and well woman and well baby visits and that kind of thing. So you are looking at those like routine care. And if you're applying at a family practice, in family practice, they got to know a little bit of everything, right? They got to know a little bit about injuries, a little bit about like just normal like colds, respiratory things. And because that's what they take care of in family practice. They take care of minor things, and they also can send them to like the specialists and things like that. So you really have to be a jack of all trades when you work in family practice. Same thing when you work in the ER. But the ER, you really have to know how to code for hydration, because that's a very key part and a key procedure that happens in the ER, because knowing how to code that is very important. And I can guarantee you, if you're applying at the ER, that's going to be one of the questions is a hydration question or something to that effect. But that's what you want to be prepared for. But again, a lot of students will get their certification and they will stop studying because they say, oh, well, I have my certification. And then when they start applying, and it takes more than a minute and a smile to get a job in medical coding. It is very difficult to get your first job in medical coding. I'm not going to lie. Unfortunately, it is this way. There's a couple of reasons that it is this way, because there's fast-paced medical coding programs. People just get lucky and pass the test and don't really know how to code, and that's a problem. But there are still people that do hire brand new medical coders, obviously, because we were all brand new at one time. And it really takes a detailed individual who can put out a really good resume and say their skills and things like that. And I'm not going to get into my resume spiel again, but because I talk about resumes and their importance all the time, because a lot of medical coders that I see, like especially on LinkedIn, they're posting their resume and they're getting very frustrated because they can't get somebody to call them back. But then I don't see any of their medical coding training as their skills. I see customer service, I see friendly, I see a smiling face, organized, team player on your skills list. No. If that is on your skills list, you need to get it off of there right away. Your skills on your resume should be, as a medical coder, medical terminology, anatomy, pathophysiology, and of course ICD-10-CM, ICD-10-PCS if you have that training, CPT-4, and HCPCS level 2. Those should all be on your skills list. Okay, don't bore me with NCD, LCD edits. Don't do that. Everybody knows that stuff. Okay. But when it comes to what employers are looking for, those things that I just said, that's what they're looking for. They're looking for those hard skills, and you got to have them on your skills list. So it is possible to get those callbacks, by the way, but you do have to be prepared. And when you do get these calls back and you get these assessment tests, you have to do the best you can, because it's going to test you on everything. It can test you on, your terminology and, how you code certain procedures, and you can't use the excuse, well, this is my first job and I'm looking for entry level. No one cares. They want you to be prepared. If you have a medical coding certification, they expect you to know how to code for everything, because we've been tested on everything, right? Every single subject has the chance of being on your test. So that's why, even if you struggle a little bit, just do the best you can when it comes to you know, how you perform on these tests, and get them turned in as soon as possible. I hear a lot of times from people who say, well, I got an assessment test and they said that I can just return it whenever. You guys, you gotta be proactive, because they need to know that you are excited about this position and that you really want to work for them, okay? So that's something that you have to know when it comes to what is the difference between book coding and real world coding. It's gonna be completely different. And what you see from the book is going to spoil you because you're going to get so used to seeing all of that information there. But when you get into the real world, you're going to see that there are things that are missing. Sometimes it's laterality. Sometimes it is an actual diagnosis. Sometimes it is procedures and documentation, you know, so that you can get to the level or you can get to the procedure code, you know. So that's a thing that you got to be on the lookout for. Just do the best you can. Don't take it personally when you don't pass these tests, because it really all depends. Some employers have a different benchmark of passing. I saw somebody on LinkedIn that was saying that they failed their employment assessment test because they got an 80 and their passing score is an 85. And so they were really disappointed about it. And while I understand, if you want to get in, you need to be a strong coder. Now, I don't know what that person missed, but you know, again, you have to do the best you can when it comes to these tests, because this is how they're going to call you back or not call you back. When I was out there applying, when I was a brand new medical coder, that's what I went through as well. And it wasn't until I went and applied at a temp agency and I took their assessment test and they were like, wow, you really did good on your test. And I'm like, yeah, okay. So what now? They're like, well, we'll give you a call in a week. And we'll see if we can get you an assignment. And I'm like, yeah, whatever. Thinking this in my head because I had been having the door closed in my face for 2 months, you know. So, but when, you know, I got their call back in a week, like they promised, and I got an assignment for 3 months. And then after that, it was another assignment for 8 months, which led me to my forever home here. So sometimes you have to start at the temp agency so that way you can get in somewhere, okay? And while it may not provide you with all the things that you want, like leave and sick time and, you know, benefits and things like that, it's a start. It's meant to get you in the door. It's not meant to be your forever home, okay? So it's, you know, just saying, starting at a temp agency is a great place to start. And when you're at a temp agency, a lot of times their standards for what you should know is going to be, it's going to be reasonable for somebody that is brand new. And so that's something, they're not going to be as strict, okay? But it doesn't mean that you don't need to try extremely hard to understand what's happening and things like that. So don't stop studying, guys. Even if you've gotten your certification, I hear that from folks too, that they say that they got their certification 2 years ago and they're still looking for a job. And then they say, oh, Blue, I got a call back and I forgot how to code. Okay, because you haven't been studying, right? So we need to be consistent with studying. You don't have to be as rigorous as you were before with study, obviously, but you do have to still make an effort to continue on studying. And at least once a week or twice a week would be great. And if you're doing the ICD-10 CM coding challenge, because those guidelines are very important. There's nothing better than when an employer can ask you a coding guidelines question and you're like, oh yeah, I know this because this, and this. That's what they want to see. Not, oh, well, I don't know because I'm new. No, it doesn't. That's not the way it goes, guys. You have to be prepared, and being prepared and having that readiness is going to show, is going to be on display if you are proactively working with your books and working with the workbooks, continuing to work on with those. The books that I do recommend, I always leave in the description box below. So I'm not going to get into those because, I mean, you've seen them 100 times if you watch my videos. I always bring them out. But again, the links are down there in the description box. They are really reasonable. They're dated from 2019. Yes, you can get the current year books of those, but they have the exact same questions as the 2019 books. And the 2019 books are a lot cheaper. So are the 2020 books of those books. So again, I'm just trying to save you guys a few bucks. But if you want to go for the new ones, and hey, you got the money for it, go ahead. But it doesn't have to take that much, especially when you are trying to study. I'm just saying. And somebody had asked me, what is the difference between physician coding and facility coding? All right. So understand first physician coding. When you go to the hospital, right? Say for instance, you have a procedure done and you get 2 bills, right? Typically it's a little bit more than that, but let's just say you get 2 bills, one for the physician and one for the facility. So when you get the facility bill is going to take care of the facility side of the house. That is going to cover the expenses for using a room or using the bed or using the supplies or the nursing staff or any of the things that the hospital provides to you, the patient. That's facility coding. That's where all that money is going to. That's that side of the house. For physician coding, that's all of your evaluation and management codes, because and the procedure codes, but let's start with evaluation and management first. Evaluation and management is the cognitive work for the provider into a code, right? Because you have your procedure codes in the CPT book, right? Because that's what the physician uses, the CPT book. So the physician, any services that they provide, any procedures that they do, obviously will come from that CPT book. But to get paid for their decision making and the cognitive work, that's the evaluation and management. That is also in the CPT book. So that's what they get. That's their side of the house. When you're saying that you're coding for the physician, you're coding for their services, for their work in doing the procedure or, doing the evaluation and management level to take care of you because they have to consider all of your conditions before they treat you, right? I've had my gallbladder removed, right? But one of the things I have is asthma. And at that, I have adult onset asthma. I did not have asthma as a child. But that was something that they had to consider when they were going to put me under anesthesia, right? Because if you have any sort of lung conditions, they have to know this, all right? Because you could react badly, right? So they have to think about that. He had to consider that before doing my surgery, okay? So that's something that when you hear you're doing physician coding, that's all of that. That's evaluation and management. That's CPT procedures. That's all of that side of the house. But yes, facility takes care of the facility side. And that's often talked about with the ICD-10 PCS manual as well. Those procedure codes are done on the inpatient side, all right? So that's all the facility and all that good stuff, because again, things that are in the hospital, that care that is being done there, that's all of that side, ICD-10 PCS. And so that's something that you should know, those differences, okay? But make sure that you do your research when you are applying at these places so that you know where you are applying. You'll know a little bit about their facility, because there's nothing worse than if the employer is asking you, well, what do you know about us when you're doing this assessment test, right? What do you know about us? And you say, I wouldn't call you back. I'm just being honest. I would want somebody who says, well, I know that you all are this big hospital and that you have this many beds, and you are famous for taking care of heart transplants, or you have this is a level 1 trauma hospital, something. I want to know, okay, this person really knows. They did their research. You can also go to LinkedIn and look at the place that you want to apply and see all of the information about them on their LinkedIn homepage. So you can do a little bit of investigative work. That does help. So it does help to prepare you, because then you will kind of know, okay, this is what I need to study to be prepared. Same thing if you are applying for, a sports medicine clinic. You obviously need to know about orthopedics and orthopedic procedures, right? Cardiology, same thing. Cardiology procedures, cardiology diagnoses. There's a lot of really helpful other books that you can get. You can always look at the coding companions. They're based on the different specialties, and you can find those on the Optum 360 coding website. They are, of course, on sale. But the coding companions are going to go into detail, and they cover all of the procedure codes for that specialty. So if you are coding for podiatry, they have a whole book on podiatry. They have all of the procedures, all of the CPT procedures, all of the explanation of those procedures, and the diagnoses that go with those procedures, the RVU generation for those procedures, and other helpful tips about that procedure code. So that it is worthwhile if you're going to go into a specialty clinic, all right? Because it will help you to better understand the procedures that go on there and the diagnoses that can go with it. It is just a wonderful, wonderful book. And again, they have them for all the specialties. So if you're interested in Optum 360, you should check it out. Of course, this is not an ad for Optum, but you guys know how much I love and trust Optum. So, but anyway, that is my advice today on this. And you know, you may think, well, you know, I've studied for my exam, I passed my exam, and I'm good to go. No, guys, it's a continual thing. I became a medical coder in 2008. I was a student in 2007. And we are in 2022, and I have not stopped studying. I study a lot, guys. When it comes to this stuff, you have to. You literally have to. And the more you do and the more you get into it, the better off you'll be. We have to know what doctors know while never having gone to medical school. That's how serious this is. If you take it seriously, you'll know that. If it's just a job to you, that's what it's always going to be. And you will miss out on a lot of good that can come from actually being involved in what you do. That's my advice anyway. If you have, if this video has helped you, please like, subscribe, and share. Leave me a blue heart if you're still studying the guidelines. Good luck on that, and I will see y'all on Monday. Bye.